Right now, I will show you a few tricks for self-trigger point release that I have developed. Also, I have kind of found out during my own pregnancy, and I also suggest to my pregnant ladies whom I see in the clinic. For this purpose, you will need a trigger point ball. This ball is quite firm, is not very soft, but most often it's just a tennis ball that you can use. So you put the ball on a soft surface that is not slippery, which is a mat. And most of the trigger points, those tight muscle bands that create pain, they are either in your gluteal area at the back of your hips or at the back of your back, most of the time. So you take the ball and remember that you are controlling your own weight and how much pressure you put on the ball. I will show you first the position where you don't need to put a lot of pressure to start with, because in the beginning it might be a little bit painful, uncomfortable, and then you can progress slowly with more pressure. So this I will use on my gluteus medius, on my bottom muscles, which are quite painful during the pregnancy in many women. I sit on it and I just gently sink into that ball. Right now, I'm not stretching my legs. I'm supporting myself with the hands, so I'm not taking too much pressure. And then I'm moving very gently. So it creates a pressure of fingers pressing around your gluteal area. If you prefer a little bit more, a firmer pressure, you can stretch your leg and take a little bit more weight. Obviously, for pregnant women, if you need, you can support your belly with your top hand if you need to, but usually it's quite comfortable. And you do the same on the other side. If you feel comfortable of semi-laying down position, you can also place the ball at your back muscle, but remember not to place it right on your spine. We don't want it on the bone, we want it at the back. And again, you go onto your elbow and very gently, with a gentle pressure, you will find a painful spot and slow movements. Sometimes some women feel that it's too much pressure, so I suggest to cover the ball with 1 or 2 layers of the towel. Also, if you're a lucky owner of a roll, it can be the big roll or it can be a half roll, not necessarily this big. You can also do some gentle rolling around your hips, which I also do with my pregnant moms after Pilates classes, and they love it. First, you sit on the roll, you place your left leg up, and you rotate to the side of the leg that is up. So in this case, left leg. And usually you find quite sore spot there, and you can roll and release. You can also do it when you have mild pubic symphysis pain that comes from the back of your pelvis. Okay, and then you roll again, up and down. All right, I hope that helps.